Hi everyone. Today is the eve of Time to Talk Day. I'm Jo Loughran and I am Director of Time to Change and we cover England. So our programme is all about ending stigma, discrimination and thinking about behaviour change around mental health. We are focusing this year as part of our Time to Talk Day, as we do every year with a different theme, on the power of small. And why is that? Because we know how important just those tiny conversations that feel insignificant to us when we're in the midst of having them can make that really massive difference to people's lives. I'm joined very luckily today by the leaders of all of our other sister campaigns, also working to challenge stigma and discrimination. And I would like now, if I can, to just ask people to just introduce themselves and tell us a little bit about, you know, the ambition for the anti-stigma programs that you're all running.
Jo, I'm Alex Bundy and I work for Inspire and I'm the Group Director for Mental Health and Addiction Services. I'm also Inspire look after the Change Your Mind anti-stigma campaign here in Northern Ireland. Inspire look across the disciplines of mental health and addictions, but also learning disability and autism, with a wide remit dealing with a lot of supported living, mental health accommodations, floating support services. So a whole range of services aimed at supporting people with mental health and addiction issues.
Thank you.
Hi Jo, I'll go next. I'm Wendy Halliday and I'm Director of CME in Scotland. And CME is the national programme that's funded by Scottish Government. And our aim is to end mental health stigma and discrimination. And obviously to do that, we really engage lots of different partners and to really try to encourage them to consider how they might address stigma as just core to their business. So increasingly what we're saying is that, you know, an anti-stigma approach needs to rest with lots of people across Scotland, and the only way that we'll address it nationally is to be sure that we are working alongside many other partners. And I guess an important part of that is ensuring that lived experience, people with experience are really guiding and influencing what we do.
Fantastic, thank you.
Hi Jo, I'm Lowry Wyn-Jones and I head up the Time to Change Wales campaign. Inspired by the campaign in England, we were very keen to have our own campaign in Wales that was owned by the Welsh people and also led by its communities as well. We are delivered by two of the leading mental health charities in Wales, Hafal and Mind, and funded by Welsh Government and Comic Relief. We've been running since 2012, and the aim is, of course, to equip and to empower people across Wales to step up and tackle stigma across individual, community and at institutional levels. And we do that in a range of ways, which we can talk a bit more about later.
Fantastic. Oh, thank you so much all for joining. And it's worth pointing out that this is probably the fourth or fifth year where we've all come together around this kind of real peak of activity. And I'm always struck by the fact that, it's really important that we're kind of talking about the topic of mental health. And one of the things that is clearly really important is through our champions, we call all of our kind of lived experience people, different things. So for Time to Change England, it's our champions. We always talk about just how important it is that they are at the heart and centre of what we do. And many times it feels as a huge burden that we're asking people to do when we're saying to them, we want you to speak out about your experiences. I'm just wondering, from your experience and from talking to your champions, how much do they value a day like today where we get the nation talking about mental health?
I think for them it's instrumental to have one day a year where they feel, they're superstars throughout the year, but that one day to shine, I think, is really, really important. Obviously, we all know that work happens every day, all year round, very often silently. Some of our campaigners through blogs and writing or talking to kind of smaller groups of people that work continues and that never really stops. But having that just one day where we can just come together and I guess celebrate the huge investment that our champions put into the campaign, but also how far we are able to kind of change perceptions and so on. So for me, I think champions find it hugely valuable to have that one day in order to come together.
Great, thank you.
I suggest it's a similar picture in Scotland, and like yourself, we have champions and lots of volunteers, youth and adult volunteers who are engaged and support the programme, and lots of supporters surrounding See Me too. And I think what's great about a day like Time to Talk Day is that it really galvanises, builds momentum really about why it's important to have those conversations. And many of our volunteers and supporters really use the day to explore and to describe what it is to experience mental health problems, to dispel some of the myths around mental health, to normalise mental health and the mental health conversations. So it's just such a good opportunity to do that. And I think, one of, I guess, all of our ambitions is that societal shift. And in order to really get that societal shift that we're really seeking, a day like Time to Talk Day is so important, and especially a UK-wide opportunity for us all to be saying it's okay to talk about mental health. It's really important that we do. I guess one of the things that See Me does is try to weave it into our programmes of work. So like other anti-stigma programmes, we work in health and social care and workplaces, community schools, a whole range of different places. And I think Time to Talk Day is really good because it's something that all of the different players can really take hold of and do something with. So I'm really excited about the opportunities of this year's campaign.
Fantastic. Alex?
Yeah, I fully agree with everything that's been said. I think it gives focus for a whole year. People can look to this day, and it's not something that we want people to talk every day, but it does culminate everything that we're trying to do and give us some focus on that. I do think people with lived experience have so much to offer, and right across our services, we continually talk about those champions and how they're getting involved and really driving and making us refocus on how we actually support and break stigma down right across the UK. When we see we're all from different regions of the UK, so I do think that this brings, it's brilliant to bring Wales, Scotland, Northern Ireland, England together, and actually bringing that into a focus and paying tribute in many ways to the works and the efforts of those people with lived experience over the year.
And I think that's so right, isn't it? It's an opportunity for those of our champions who are at a point in their recovery where actually being able to talk about their experiences is really important. And I think one of the things that always strikes me when we talk about talking is one of the things that people sort of say is, but it puts such an emphasis on individuals to kind of reach out and to talk about that personal experience. And I suppose there's two things that it's worth exploring. I think the first is kind of, it's as important that we know how to listen as it is for us to be able to expect people to talk. And I think the second thing is there's something for me around the fact that sometimes that talking is about the topic of mental health, as well as reaching out to those people who we are worried about or who we already know might be struggling. And I think this time, this time last year, we were just thinking about this new virus and how, what the impact of that was going to be. And now we've been nearly a whole year, within its grip. And I think now more than any time ever, this whole concept of reaching out, of checking in with people, of talking and allowing people to be heard is just so phenomenally important. And again, I wonder if there's experiences from some of the champions that we've all worked with that kind of help to kind of demonstrate why bringing this to the fore and having this as almost like a conversation starter, a point that people can jump off from into that world of conversation is so important.
Absolutely, and I think this year more than any other time, in certainly the time I've worked on this campaign, is that you don't have the luxury of being able to go over to somebody's desk or over to somebody's house to see how they are, where you can truly get a sense maybe of how somebody's doing. Mm-hmm. Yes, it probably takes more effort to do that, to pick up the phone, to text, to call them. But we know, statistics show us that people's mental health has massively deteriorated over the past year. People who may never have experienced distress or mental distress in the past are now experiencing this for the first time. I would hope that we emerge from this pandemic with a more tolerant and more compassionate society, because if you've experienced it firsthand, you will understand possibly or begin to understand what somebody else who has experienced mental health issues all their lives are going through. But you're right, I think that encouragement and really urging people to have those conversations, but also to know how to listen as well. That's really important, because what we don't want is for people to be encouraged to open up those conversations and for the receiving end of that not to be positive or not to be supportive.
I support all of what's gone before. I think we asked our supporters, so we put a wee poll out to supporters to ask about, and all of the supporters that experience mental health problems and have done in the past. And when we asked them about the current experience around, the pandemic and the social isolation and the lockdown and the impact, what came through quite clearly was a growing sense of self-stigma. So 54% actually said that they felt really uncomfortable about speaking about their mental health, despite maybe feeling more comfortable about it previously. And I think it was that sense of, due to the pandemic, lots and lots of people are experiencing, as Laurie says, lots of people are experiencing mental health challenges maybe haven't had in the past. And I think it's that bit about, a real sense of everybody's really busy, everybody's experiencing it, I shouldn't reach out, why should I reach out, what makes me different? And so I think what we've got to be really careful of is, in this really positive growing discourse around mental health across the UK, across globally, I think there's a sense that mental health is profiled much more highly than before, and rightly so. I don't think we can be complacent and assume that everybody's talking about mental health. I think we know that there are populations and groups and people who, for whatever reason, just aren't. And that's maybe for fear, for anxiety about what's going to happen when I do open that conversation, etc. So I think there's something for me about now more than ever, we should really be encouraging people to open up no matter what their circumstances. So if they're experiencing mental health problems for the first time, or if they've had existing mental health problems or previous mental health problems, it doesn't matter. You need to be able to speak out and be comfortable about that. And I think Time to Talk Day gives us a chance really to put a bit of momentum behind that.
I agree with everything that's been said, and I think very interesting conversations this week actually with staff, who are looking after semi-structured group work that we do, mutual aid group work, and saying that they really can empathise, maybe for the first time for some of them, around isolation and anxiety, and how they can now associate that with what people they work with have been experiencing, and I think that's brilliant. But I do think that mental health is very firmly on the agenda, and it's brilliant to see that. And I think it's been highlighted through the pandemic that mental health has been affected, and hopefully that will, transcend into resources and ideas and concepts of how we're actually going to address and treat whatever comes out the back end of that. But the concerns I do have, I suppose, sometimes are that, are we necessarily looking at the factors that are there around, for example, things like poverty, health inequalities, and then some of those drivers, are we actually putting that on the agenda? And that's what we're hearing from people who have experienced mental health problems in the past. Those are the things that are actually driving their poor mental health. And as much as they think it's good to break the stigma, sometimes the other things that need to be talked about aren't as a parent are on the agenda for them.
And I think that's an important point, isn't it, Ben? And I think there's also something around what all of us do around challenging stigma and discrimination. And Wendy, you often talk about that as being kind of foundational. And what sort of strikes me also is that I think that we're right not to be complacent, and I think we're right not to just make an assumption that Time to Talk Day fixes everything, or that talking fixes everything. I think we've all got huge programs of work and activity that sit around this as a day, don't we? We've got all of our work with children and people in schools. We've got our peaks of activity where we target, in this particular phase, men. We've got our work with employers, and we've got things like our national activity and addressing things in the media. And I think that's really important. The second thing that I think is quite important, and I'm interested to hear people's views on as well, is around how important it is to be working closely with both partners in the wider sense around the mental health sector, partners in terms of corporates, people who will be able to take our messages and amplify them, but also to be sitting within in our case, Mind and Rethink Mental Illness, to mental health charities that are quite experienced at challenging some of the things that perhaps we don't have a remit to talk about. I'm just wondering about how important all of those factors might be for everybody, and people's experience of how they've kind of knitted together to create a good, wholesome whole that allows the sort of the environment to be one that is safe for people to talk about this as a topic.
I'm quite happy to pitch in, Jo. I think for me, Time to Talk Day is, as you say, it's about conversations. It's about really encouraging people to have those conversations. But inevitably what we're hoping is those conversations lead to something. They lead to something in terms of making better outcomes, making it a better experience for people, those that speak out and those that are listening and trying to guide and support or provide signposting or whatever to people. So it's that relational conversation. But I think one of the things, just as you were speaking, that really struck me is, in order for those conversations to be successful, the infrastructure needs to be in place. So that's where we do need access to good supports for people when they're reaching out for the first time. Where can we guide people to? And I think Scotland, as I'm sure is in the case of your own countries, we've invested significantly in that infrastructure, trying to be sure that where we can, that people, once they've identified that things aren't quite right, they're struggling with their mental health, they can reach out as early as possible. And I think that's where it's important in terms of our work can't sit in isolation. It needs to be part of that wider infrastructure and that wider partnership approach. I think we all know that there are challenges with some services and levels of support just with the demand at the moment. But I think what we can do is we can add to that sense of early intervention. The sooner people can have the conversation, then the hope being that, steps can be taken as early as possible, prevent things from escalating wherever possible to a point that it's a crisis and an intervention at that critical end of things. So for me, it's something about just appreciating that what we do is within that context, and as you say, it sits not in isolation, but as part of a wider programme and approach. And the point, I guess, that Alex was making too about some of the inequalities, I guess, that people with lived experience come forward with. Often what they're describing is their challenges right now with all of those different aspects, be it poverty, be it about job security, be it about housing, tenure, whatever. And I think, again, that's where it's so important that we've got those partnerships to be able to guide people to the right levels of support and ideally, get the support in the right way for them.
I completely agree. I think we as, collectively as campaigns have a real sense, or should have a sense of responsibility that from the moment we engage with people who bravely, make themselves known to us and want to share their experience, that we can confidently signpost them to where we think, is the most appropriate avenue. And I know I can't say hand on heart that, in Wales, that every single person experiencing mental health issues will get the sort of support that they need. I don't think any of us can say that. And there are fundamental flaws and lack of funding and all of the things that we hear about, day in, day out. But you're right, we're one significant but small part of a much bigger ecosystem or support system. And I think, days like Time to Talk Day really highlight and define who we are and define who we're not as well, because I'm sure you would agree that occasionally we have maybe been seen to or been perceived maybe by some of our supporters as maybe wanting to be everything, and we have to be really clear around the boundaries of we're an awareness raising campaign. We campaign for challenging stigma and discrimination. Yes, we support people up to a point, but we don't offer services in many ways, but we have those relationships. We can pass on details of our host organisations and all of the really strong networks and partners that we have sitting behind the campaign. So I think it is very much about the identity and how we're perceived by our supporters, because I think that's really, really important, so that people can manage the expectations really of why we do what we do and what we can't do as well.
Yeah, absolutely agree again. And I think, from our perspective here in Northern Ireland, looking at, how do we break stigma, but also how do we increase conversation and make every contact count, when someone comes into contact with someone else, that really needs to count. And also the value of the small conversation. And that's part of, what we're here to talk about. But, just asking those questions and taking an opportunity to listen. We're not here, and we can't fix the world because we don't have all the existing services or the external services. But it's also, I think, when we get into that help-seeking behaviour and people actually reach out for help, trying to tie up as best we can and making sure that we are linked. And you talked about partnership working, and it's so important that we have and form those partnerships, whether it be at a community level, whether it be, we work with sports very closely, whether it be within employers and our employee assistance programs, but making sure that people are aware of the help and support that is available. Because, when we look at a lot of the referrals or a lot of the people that we would support, they're actually not aware. And what doesn't help is this sometimes blanket statements that there's no resources or there's a lack of resources right across the board, and sometimes that actually stagnates and stops help-seeking behaviours coming out.
And it's really, again, sort of just picking up on that bit. And I think that there's something also around trying to encourage people who are on the kind of listening end of that conversation, that actually people aren't expecting, one, all the answers from you, and two, they don't expect you to be an expert, but actually it's that ability. I know, I've had conversations with people running late for a train. Well, not running late for a train. Trains are completely stopped working. Having a conversation where everybody starts to be, have that camaraderie, because we're all in the same boat, and you chat for the first time, mostly on the commute. You're just doing that, right? But you chat, and then people say to you, oh, what do you do for a living? Well, I very proudly run this program called Time to Change. It's anti-stigma, it's behaviour change. And they go, oh, that's great. And then I've had those conversations with people because they feel, one, permitted to have that chat with me, two, because they know that I'm very likely, unless I'm doing my job quite badly, to be quite receptive to hearing what people have got to say. And I've seen the kind of almost transformation of people who may have really not spoken about this at all, or to very few people, feeling the freedom of being able to have a conversation about their mental health. And I often talk about it as being like it's everyday and ordinary, because we know that it is. The spectrum is really everyday and ordinary. And I think there's a risk in that sometimes too. And again, I'm interested to hear what you have to say about this too. But there's also a kind of a risk around, are we encouraging people to experience life's complete ups and downs and the emotions that go with that, and putting them into a box that says this is a mental health problem? And I suppose we have to be quite aware of that and quite on that. And I'm quite interested to hear what people think about that, and how you've worked through that with both your champions, but also with the general population, in trying to talk about what we actually mean by mental health, and what's the everyday ups and downs and emotions of life.
I think just going back to some of the work that we did with young people, and this is very pertinent, where our approach was quite cautious with young people, that we didn't turn everything in relation to becoming an adolescent and all of the kind of ups and downs and challenges around that we don't medicalize those very natural reactions to growing up and to forming relationships at kind of secondary school age. And I would say the same is carried through in our adult work as well, that not every kind of feeling low or emotion will be, assigned to a mental health condition. But I think all of this is rooted in awareness, in education around conditions. And the more we have of that, the more people are able to almost self-verify, where am I at, and place themselves on a particular spectrum, if you like, of, mild, moderate, severe. And I think it will take time to do this. And I think the more we talk about it, the more we normalise those conversations, the more information that is out there. And it's not our campaign to give all of that. I think that's a collaboration, with public health campaigns and other, third sector organisations collectively to do that, and to impart that information to the public, so that people feel armed with that information to make those kind of informed decisions of, do I need to go and see a GP? But I think if we take physical health, for example, you wouldn't think twice about going to a GP, if you had a strange rash or a lump or something like that. And I think, the same is true with mental health issues, that it's always worth getting it checked out, and it may turn out to be, an episode of distress or whatever it might be, if somebody's just not feeling quite right. And that understanding that, not every emotion necessarily means that it's a mental health issue. So it's something that we talk about quite a bit, and when we present to all sorts of different people, that we're very clear that we shouldn't be medicalising and armchair diagnosing everybody with a mental health issue. And I think, given that we are working through a global pandemic, that's even more important, where people will have natural responses to trauma. Let's be honest, it's been a traumatic experience. I think it's on some level for everybody, and that actually fear, worry, panic are all very natural emotions to or reactions to the pandemic, something that we've never had to grapple with and never had to experience before. But not all of those will obviously end up to be sort of short or long-term mental health conditions.
Yeah, I think that's really, really cool in terms of a kind of us thinking that through. I'm conscious that, surprisingly, time has gone very quickly and we've only got a few moments left. So I'm wondering if as we go round, before I kind of finish up properly, that we can think about what our one top tip would be to really encourage the nation to get talking. I think mine is going to be reiterating that don't worry about being an expert. You don't need to be. And I'm going to pick on Laurie to basically go next.
I think mine would be that thinking about talking to somebody is way more daunting than actually doing it. And I think 9 times out of 10, that will be the case.
Nice. Wendy?
Yeah, I think mine would be about trying not to worry about the conversation, don't overthink it. And from a point of view of somebody sharing how they're feeling, it's that don't worry about the fear of what's going to happen if I do share this. It's about the theme is power of small, and let's start small and really start with what the burning issue is for that person. That would be my core message.
Fantastic. Alex?
Was that the one thing for me is around shame, and you've nothing to feel shameful about when you talk about mental health, and just we are all part of breaking the stigma and taking that shame away. So just reach out and ask for that help and support.
Fantastic. Thank you so much, everybody. I really, really appreciate your time today. I'm sure everybody will appreciate hearing from you and from your views and some of the topic areas that we've touched on. So just to reiterate, tomorrow is Time to Talk Day, and we want as many of you to have a conversation as possible. Think about your family, your friends, your work colleagues, the person down the road. Don't mind who it is, but just reach out, have a conversation, ask somebody how they are. If you need to, ask them twice. Really show that you're interested in hearing what they've got to say. Conversations can happen in all sorts of ways. It's not just that face-to-face. It's not just having to be verbal. Reach out via WhatsApp, via social media, but just do it.